Welcome to a community update from the Department of Senior Affairs. I'm your host, Ed Nunez, and today's topic is social determinants of healthy aging. With us to discuss that is Dr. Ann Simpson, the director of UNM School of Medicine, Institute for Ethics, and Elise Williams, student at New Mexico State University, scholarly intern with the UNM School of Medicine, Institute for Ethics. Ladies, thanks so much for being with us.
Thank you.
We know it was a short notice, but I just couldn't help when I got this via email. You know, we work for the Department of Senior Affairs, aging. You know, we have so many issues that go on with the elderly. This just caught my eye. Had to learn more about it. I think it's going to be some great information for our senior audience here.
Well, thank you.
So why don't we, you know, again, the word itself, what do you mean by social determinants of healthy aging, Doctor?
Okay. Well, over the past 30 years, there have been a lot of research looking at social determinants of health. And these are those things that are separate from your direct provider-patient engagement that really impact health and healthy outcomes. And so as a geriatrician and having practiced with geriatrics, I recognize there are many things that impact an individual as they age that lead to healthy aging. And things such as your community, community engagement, education, social justice issues, access to food, access to transportation. So a lot of those things impact how one ages.
You want to get specific on any one of those? I think one of the things you mentioned, you know, the access to transportation, to nutrition, that's certainly not just a New Mexico or Albuquerque issue. It's a nationwide issue. And as people age, and I know you just went to, one of your colleagues went to the conference on aging last week. I'm sure you learned a whole bunch. But just some of the things you mentioned, you know, piqued my interest again. You want to mention any one of those that you're talking about?
Yes, in fact, since Miss Elise here has done so much work researching transportation for us, I'm going to let her take that.
Well, at our first lecture series, I gave a presentation about transportation, and I went to this website called walkzone.com, and it ranks our walkability and our transportation, and we scored, I think it was a 30 out of 100 for transportation, and I believe a 40 out of 100 for walkability, or I might have those reversed, but it means that we have transportation, but it's very limited to what we can use. For instance, according to a study I found conducted by the Department of Senior Affairs, transportation was a big issue because public transportation, bus routes are very confusing for the elderly. They may be, 1.5 miles away from someone's residency, or they might have to walk a long distance to get to where they're trying to go to. And on-demand transportation is really important. But from my findings, I found that we probably have maybe 3 or 4 companies or 3 or 4 services available here in New Mexico. And since we have a growing elder network, and even those that have limited resources, that might be an issue, because you have the Silver Runner, which is a really great transportation service they have. It's more chauffeur, what's the word I'm thinking of? Comfort valet service, somewhat. And they charge $29 an hour, but they accompany clients to their appointments. They have door-to-door service, so they escort you from the car to your house, or to your house into the car, or even to your appointment. They even take their clients to events like plays or musicals, just to get them involved in the community and out there. But if you have a limited income, there's Sunvan, where they charge $2 per trip, and you can do as many as you want. But they have curb-to-door service, so they escort you to and from, not to your door, but just on and off the bus. And it's really limited. You have to be able to manage your time wisely, and you have to, there's not someone there to help you, more or less, get more involved. You have to do it yourself.
Right.
So.
Go ahead, Doctor, I'm sorry.
Oh, no, I was going to say that one of the reasons this is something that we've targeted, it is not just because it's the elderly, but if you think about the population dynamics right now, we have the fastest growing segment of the population is the over 85. Then we have now more people over the age of 60 than under the age of 5. So when you look at what that is shaping up to look like and thinking about who's maybe providing care to whom, you really want to have everyone to be able to have access to transportation. And so you think about the children being able to access transportation for school and whatever other events, but the elder population need to be able to access transportation not just for health care, which is why it's a social determinant of healthy aging, but to things that matter to them, be it church, community,
Exactly.
or whatever.
Well, I think one of the things I wanted to say was my mother's 88 years old and lives in an assisted living, and boy, I have a hard time. She's, she has to have a van, and it's hard to get transportation for her. So with some of the things you were talking about, certainly hit home there. Determinants, what do you mean? What does that, determinants,
Right.
what does that mean? In other words,
Yeah, so these things
factors
factor in. So
holding us back, or is
transportation.
that what
Yeah.
that means? Because the people are
Right.
going to want to know.
Right, so you really want to look at those things that have meaning to you that determine healthy aging. For instance, having a community that you're engaged with, and having activities that have meaning to you. For instance, your mother in an assisted living facility, and they can actually have, a transport service that will take people around. But perhaps they only take them to where the majority of the group wants to go. And so if your mother has particular interests, she may not be getting to what she wants. She will be more isolated. So even though that's not about diabetes or hypertension, that is a determinant as to whether she will age well.
Right.
So the determinants are those things that help people accomplish well-being.
Individualistic needs aside, I mean, let's be honest here. You're not going to be able to cater to all the individuals.
Exactly.
What then? And I guess some of the things that you're studying about transportation,
exactly.
nutrition, things like that, we're all in this big web. And you just mentioned some interesting statistics about more people that are 60 than are 5. That's huge. And there's going to be more baby boomers retiring every day.
Right. Right.
And so,
And there's other factors like millennials moving out of state to live in areas that have that give them more access to what they're looking for, whether it be jobs, walkability, events, certain things that cater their needs that New Mexico may or may not have.
Dr. Simpson, why is this topic important? We talked about a lot of things, and we could brainstorm probably or go off topic and think about things about social determinants, and they all matter.
Right.
But why, in particular, these things that you're talking about, transportation, nutrition, social determinants of healthy aging, why is this important? And there's a number of reasons, I'm sure.
Yeah. I think one of the reason it's important is because everyone matters. None of us live or function in a silo. I know a lot of things that we do, you sort of think that way, even in medicine. There's the cardiologist, the pulmonologist, and the this and the that, and you've got the business school, and you've got the this school and that school and the law school, but we don't live in a silo. We live as part of a community, and we have to share resources. And so when we think about living inside of a community and thinking about how we share these things in a way that makes sense, we have to be inclusive of everyone. We have to be thoughtful about what this means across the spectrum. And if we attend to the needs of everyone, we attend to the needs of the elder. But in particular, I focused on healthy determinants of the social determinants of healthy aging because that is my population that I take care of as a physician, and because I've spent a lot of time with these people. I've worked with them, I've heard their stories, I visited with them, be they in clinic, in their home visits, nursing homes, and some of the things that I saw and heard really made me recognize that other people needed to know about it. And doing a home visit and going to see someone at home and seeing that a child has been kept out of school to take care of this elder. And it doesn't just happen with elders. This happens with people with disability who may be younger but vulnerable folks. And so if you're keeping kids out of school to take care of an elder because you can't afford to hire a caregiver, you're also perpetuating a cycle of poverty because this child is not getting educated. But there are perhaps resources that might make sense, like long-term care nursing homes. People cringe at that, but that is, those are facilities for chronic care. And if, in fact, we as a community supported and included long-term care facilities and the people who live and work there as part of the community, I think we might not be as afraid to actually have our loved ones live there. It clearly meets a need, but the community's engagement with it would make it even better. So all of these things are reasons I think it matters, because it's important to every one of us. We all love people, and it impacts people that we care about.
One of the things, do you want to weigh in on that, Elise?
Oh no, you're doing a great job, Dr. Simpson.
One of the things that you mentioned was, having a relationship with a lot of people, and it's a cultural thing. They don't want to put their parents. I had a real hard time putting my mother in assisted living. Very hard time. There just wasn't any other choice because we all work. I work. My brother works. My sister works. But it's a cultural thing. Now, what you mentioned was, New Mexico. We mentioned this before we got on the show. Ranks 49th in a lot of different areas. Hey, I love my state. You do too. So do you. We all love it. There's no question there. But because of that, there's a cultural thing. They don't want to put the mother or dad or grandma on. How do you get over that? That stigma, because you mentioned we have to be engaged with the rest home.
Right.
They have horror stories about that. So and a lot of people say, and I said it too. But we're actively involved. I'll walk in there. My brother walks in there. My sister. What's going on? So we're engaged.
Right.
What do you do about that? Because there's people that would never. They just hear. They're not going to do that. You make sense there, but how do you do that?
And part of it is getting people involved, whether you have someone in there or not. I love those people. Oh, man. Hearing their stories, talking to them, even those with dementia. Sometimes they say things, and yeah, it doesn't make sense, and yeah, they're repetitive, but not everyone in there has dementia. They're in there because they have particular needs. I love and getting people to go in to actually relax and recognize that people in long-term care facilities are all of us just older and with needs that can be addressed within the facility. And many of the people who work there love working there. But part of what we need to be thoughtful of is many of those facilities are owned by outside corporations, and they are the ones who are controlling the finances. But if the community starts to get more involved and to step in and say, wait a minute, you're not taking that money out of here, you're leaving it, we need these things. So part of it is bringing ourselves to be more engaged with it.
I guess the other question I'm going to ask you is this, in an era where there's less community involvement than more, and that's true because a lot of people are like, I don't want to get involved, that's not my problem, but it is.
It is.
So what do you do about that? Because again, a lot of people, they just don't want to get involved. They've got their own thing going. It doesn't affect me, but it will.
I think you just have to remind them that it is going to be a problem because one day that's going to be them. And in 2030, we're going to be number 4 in the nation for having a large elder population, and a large percentage of the baby boomers are going to retire, but we shouldn't wait until then. We should start working on it now so that once we hit that point, we're prepared. Because as Dr. Simpson always says, the train's left the station. We have to try to work and catch up to fix these issues now so that when majority of our community has retired, they have the access and the care that they need. And also, like us millennials or even the generation before us, we can work to improve that constantly. And it's not going to cost as much as it would then as it will, it's not going to be as expensive in 2030 as it's going to be now to fix these problems.
Then you talk about, you know, the limited resources that you talked about, federal dollars, state dollars. I mean,
Right.
those are things that you're right. They need to start thinking about right now, because you can imagine the costs in 2030 as opposed to 2014 where we're at now. So boy, that's smart thinking, and hopefully people are looking at this, not just, you know, I'm sure you have a bunch of eyes on it, but that they do something. That's the thing.
Right.
You can talk all you want. But
Right.
what's your plan? I would say that.
Exactly.
Doctor,
Exactly.
what inspired you to look into this topic? I mean, this is a great topic. It's got my mind whirling. What had you look into it?
Well, you know, it's been the work that I've done with the geriatric population, in addition with doing ethics and ethics consultation. And Kathy Combs and I, who unfortunately couldn't be here today, but she is a licensed social worker, and she's also been doing elder care for many years. That's been her area of expertise. And so we have both been committed and just love the population and appreciate the needs and appreciate the fear that many people have about engaging with the elderly. And I think part of it is because their fear of getting older. We're all getting older. We have two choices. You're going to get older, and either way, it's not even a choice. You're going to get older and die, or you're going to die before you get there. Either way, you're going. And so we just happen to love this population and think, well, what is it that other people don't know? And I'm going to tell you a story. One of my ladies in the nursing home, and she was a woman who had signed herself into the facility. And at this point, she was 99 years old. She and I had a conversation about why she'd signed herself in. She had, as many people do, other plans. But that plan fell through because the person who was going to take care of her died, preceded her in death. So here she is in the nursing home, and she said to me, she said, well, I'm here. I actually had time to go and investigate and see which facility I wanted to go to. And she said, the people are nice. I like being here. And the best thing of all, you don't have to cook.
Wow. Yeah. And, you know, that would be a big thing. Someone's taking care of them. You
Right.
mentioned that. You
Yeah.
know, they've taken care of someone else, and now
Yeah.
it's their turn. So
Yes.
I could see that. You know, I could see that for sure. We have stories like that every day at the center, and they come, like I said, they come for breakfast and lunch. We don't serve dinner, and there's been demand, you know, asking for that. It's like, wait a minute, you know, well, no, we can't do that. You know, and you know, our membership is $13 a year for, you know, to join all 7 centers, and I think that's just we
That is
deliver
wonderful.
services to a number of different participants on different things, transportation, nutrition, you know, we do a lot of things. I think our department's an amazing one. It really is. And, you know, the social detriments of healthy aging isn't just about the elderly.
No, it's about everyone, because as we've talked about throughout, is that you can't take care of one group and not take care of the other. And if you really truly want to take care of the elder, you're going to have to take care of the children and the other generations that precede the aged generation. So, and also you have to think about workforce, education, nutrition for kids. All of those things impact the elder community. And when you think about workforce, again, if you're looking at the population that's coming along, there's not as many of them. And so where are you going to get the workforce? And sometimes people say, well, we'll just go to the underdeveloped countries and bring in people to work. Well, there's an ethical issue there. You're robbing them, so you're doing a brain drain and bringing them here. So we have to be thoughtful about these things. And so that is why it's about all of us. It's not just about this one group, this one segment of the population. It is about each and every one of us.
Yeah, that makes sense. It's all tied in. The better the you know, the elderly is, and, you know, the youth, and it kind of is a full circle. It goes in a full circle of life. It really does.
Yes,
You
absolutely.
know, the better it is for everybody, and there's definitely some connections there. You know, you got a series coming up. I know you wanted to talk about that. What do you see as the goal or goals of this series? I know you had a series coming up April 8th. Is that
Right,
right? You want
yes.
to talk about that a little bit?
Right. So we have, so the series that we have going on, we've done the first, and we figure this is going to go for at least a couple of years. So April 8th, the topic is going to be housing and looking at housing as people age. What might that look like? Will it be single-family housing, shared housing, some type of structured long-term care environment? Because people are creating now their own environments. You have people in some communities that are creating shared housing based on professions, like musicians, having shared housing with other musicians,
Interesting.
artists, and
Wow.
different people. So we'll be talking about shared housing.
You want to tell us April 8th, you said,
Right,
you want to mention the
April
time
8th,
and place and everything? and
right,
where
it'll
we're
be
gonna be at?
4:30 till 6:30 at the Determinants Center at the university. All of these series are free. Parking is free as well. And what we do is we give a presentation and then we open it up so that the audience can contribute to the discussion. It's not talking at you, it's sharing information and then hearing what others have to say and helping us think about what the needs are and other topics people might like for us to bring to the table. We're going to be talking about safety at one of our sessions. We're going to have architects and planners talk about what do you need to do to your home if you want to sort of retrofit it. And so we have a lot
Whole
of
bunch of different
topics.
topics.
Yes.
Got about a minute left. Elise, you want to wrap this up? Anything else you got to say about this whole topic, which is social detriments of healthy aging? Anything else you want to? You're the intern here. What do you got for us?
Usually the interns don't talk, but I've had a lot of fun working on this project. It's helped me become more visual about what's going on in my community and the communities that surround me as well. Like, my community is somewhat isolated, you would say. I live in the southeast area, and you notice that the closest thing to us is probably a liquor store and maybe the Costco. And in other communities, such as the university community, you have a Smith's and the university, so they're not too isolated from one another. So.
Well, one last word, Dr. Simpson, before we close out. Anything last thing to say?
Yes, I want everyone to think about the social determinants of healthy aging. That implies no matter what your age, if you are a pregnant woman, that relates to you and your unborn child, as well as if you're the 102-year-old person. Dr.
Ann Simpson, Director, UNM School of Medicine Institute for Ethics. Elise Williams, student at New Mexico State University, scholarly intern with UNM School of Medicine Institute for Ethics. Thanks so much for being our guest. It was a pleasure.
Thank you for having us.
Thank
bet.
you.
For the Department of Senior Affairs, I'm Ed Nunez.